Leashed potty breaks. No jumping or running. Use a short 6-foot leash. No retractables. Choose flat ground, no hills or rough terrain. Take several short duration walks instead of a long one. Create runways. Walking on slippery wood, stone, or tile floors is really hard on dogs that have joint problems. Traction beneath their paws can help prevent slips and falls. Create runways that go from one room to another or from the recovery area to the door you use to take your dog outside. Don't forget about non-slip surfaces inside the recovery area too. You can use things like interlocking foam mats, yoga mats, non-slip carpet remnants, carpet runners, or a patchwork of throw rugs. Throw rugs are notorious for causing people to trip and fall, so be careful with those things. Note-taking tips. The recovery journey is long. Memories will blur. You'll avoid a lot of confusion by writing detailed notes. A spiral-bound notebook is perfect. Write the date and time for each entry. Save these notes in case your dog tears the opposite CCL. The first thing you'll want to do when the vet says your dog is healed is to take those notes and chuck them in the recycle bin. Don't do it. If your dog tears the opposite side, you'll want to look back on those notes. So, what do you write in your notebook? Noteworthy topics include things like bruising, swelling, incision healing, pain control, challenges with giving medications, medication sensitivities or side effects, weight bearing, peeing and pooping, eating and drinking, symptoms like fatigue, vomiting, nausea, oops moments like medication errors, or physical issues like slips or falls, calls to the veterinary team including what the doctor said. If you do something like make an error, don't be too nervous or embarrassed to call your vet. They'll want to know. How to create a safe recovery area your dog will love. We'll start with a few enclosure options. Crates. Is your dog used to being crated? If yes, you're good to go. If not, you'll need time to train them properly. It's not as simple as sticking them inside with a toy. If you or your vet prefer a crate recovery, please do some pre-surgery training. Enclosed recovery areas. This is a great option for anxious dogs or ones who aren't crate trained or can't be trained in time for surgery. Recovery areas enclosed by exercise pens make getting to your pet so much easier. You might actually be able to spend some time hanging out in there with them. Unlike crates, dogs in recovery areas have an easier time stretching out, standing up, and moving around, but in a slow, controlled way. A word of warning: consider your dog's temperament, size, and physicality when choosing the type of enclosure. Are you going to pick a plastic gate section, wood, or metal? How high should that thing be? Think about that ahead of time. Do you have a Houdini escape artist dog? If your dog is a chewer, digger, jumper, or barrel thrower, a plastic gate enclosure probably won't do. Is isolation okay? Some put post-op dogs in basements, bedrooms, or kitchen. This comes with some challenges, especially for the nervous types, or if the room isn't one where your dog usually hangs out. For some pups, isolation causes anxiety or boredom, resulting in digging holes in carpeting, scratching or biting through doors, walls or wood trim, or barreling over, around, or through whatever's confining them. Ways to help your dog love their recovery area. Set up the recovery area ASAP so you, your family, and your dog can get used to it. Before surgery, keep the entrance of the recovery area open so your dog can choose to go in on their own. Give them a food treat or a new toy to play with so they associate pleasurable experiences with being in their safe area. Do some practice sessions where you sit in the recovery area with your dog. Act like it's normal. Read a book, watch TV, surf the internet, or just give your dog a nice massage. Aggression. Even the most loving post-op dogs can become aggressive. It's especially true when other pets or children get too close. Help your dog feel safe by having their own space. Always supervise when other pets or children are nearby. A room with a view. Dogs that lose their minds when a squirrel hops by or if a UPS person delivers a package probably shouldn't have their recovery areas positioned by a window. It's especially important for the first couple of months after surgery because the bone is most vulnerable during this time. Temperature. If you've ever had surgery, feeling cozy is soothing. So you'll want to avoid setting your dog up near a drafty window or door. Here's something you have to know if your dog was sent home wearing a fentanyl pain patch. Dogs wearing these pain patches should never be overheated. Even seemingly safe things like letting your dog lie near a fireplace, wood stove, in a sunny spot, Applying things like a hot pack or letting them lie on a heated dog mat can be dangerous. Overheating a dog with a fentanyl patch can release a life-threatening dose of the drug into their bloodstream at once. Sights, sounds, and sniffs. Think about how you feel when you're barfy and in pain. We don't want too much of any one thing. Sights, sounds, and smells included. A soothing environment is best for your dog. Use unscented cleaning products, detergents, and fabric softeners. Do your best to keep your house calm, quiet, and predictable. Helping dogs cope with a cone collar. Dogs wearing cone collars get instant sympathy, don't they? This is why vets say cone collar compliance is so low. No matter which you choose, you won't regret doing some pre-surgery training sessions. Cone collar training sessions should last only a few minutes. Desensitization makes training easier. Step 1. Let your dog see the cone collar and sniff it. Don't let them think it's a toy. Step 2. Set it nearby as you pet them or watch TV. Step 3. Place the cone collar so it slightly touches their body. You can even stroke it against their leg or something like that. Offer treats and quiet praise if they stay calm. Step 4. Put the cone collar on your dog. Do it in a calm environment and stay positive. If you need more help, you can find lots of positive reinforcement training tips online. Never scold your dog because then your dog will associate the cone collar with getting in trouble. If your dog is miserable with the plastic cone collar your vet gives you, there are alternatives. It's wise to have 2 options on hand in case one doesn't work. How to help post-op dogs walk. There are a variety of harnesses on Amazon or in pet stores, but I have 2 favorite brands. Help 'em Up harness. This is an excellent choice for large or giant breed dogs because it has a good sturdy handle. It's great for males because it doesn't push on their anatomy, so they can easily pee and won't wet the harness. This harness does have a lot of straps and fasteners, which makes it a bit of a pain to put on and take off. The trade-off, it makes helping big dogs so much easier. Check the skin along the inside of your dog's thighs to make sure the harness parts are not chafing and causing irritation. Ginger lead harness. I love this brand. If you have a boy dog, you need to move like a ninja right before they pee. Get the harness out. Once they pee, get it back under their body to get them back inside. If the harness gets wet, no big deal because you can stick it in the washer. The wonderful owners of Gingerlead gave us a 10% off discount code that can only be used at gingerlead.com. Type the code RunAgainRover in the veterinary discount box, and RunAgainRover is all one word. Towel sling. You can use a folded towel as a sling or harness. They're really tricky to keep a hold of, especially for large or giant breed dogs. If you have a male dog, you're going to need to get the towel sling out from under their body so they can urinate and then put it back under them to help them get back inside. How to train with a harness or sling. Practicing with a sling is helpful for dogs and people too. Indoor training sessions are optimal because indoors is predictable. Keep your training sessions to about 3 or 4 minutes. Here's how you do it. Number 1, position the sling under the belly, just in front of where your dog's hind legs meet their body. You don't want the sling to be under their belly, like midway, because then the direction of the pull isn't where you need it. You want the harness to be positioned back because it's the back part of your dog's body you're trying to lift up a little bit. You want the dog's paws to stay on the ground. That's one of the things I didn't know. I thought I was supposed to pull the harness up far enough so my dog's paws came off the ground. I don't know why I thought that, but that's not the case. If you do that, you're putting extra strain on the dog's back, and by lifting them up in the back, you're putting lots of pressure on the front, so the shoulders and front legs. Number 2, have someone stand across the room holding a treat, or put a treat on the floor a short distance away. 3, put minimal upward tension on the harness, almost as though nothing's there. Slowly walk next to your dog as they attempt to get the treat. Give lots of praise. Do this a couple times a day for a few minutes at a time before surgery. As your dog learns to accept the harness, you can start to apply a gentle upward pull to help support their hind end. Remember, paws can stay on the ground. It's okay for your dog to weight bear post-op. After some successful indoor training sessions, try outside. Potty break recommendations. Flat ground is easier and it's less painful for your dog compared to hills or rugged terrain. If your dog is reactive, take a look outside. Make sure there are no birds, wild animals, neighbors' pets, UPS drivers, dog walkers, delivery people. Does it sound like I have a reactive dog? Yes, I do. Runways. Use carpet runners, yoga mats, or non-skid mats as runways for slippery wood or tile floors. Encourage your dog to use these runways by having them follow you as you praise them or give little bits of kibble. Furry paws. Get rid of Grinch feet. Slippery floors are a problem for dogs with CCL tears or arthritis, and dogs lose traction when fur grows over the edges of their paw pads and underneath their paw. Trim that fur along the top, bottom, and edges of all 4 paws. Nail trims. Did you know that dogs use their nails to grip the ground? Overgrown nails are actually painful and they decrease traction. Ideally, you'll want to trim your dog's nails before surgery day, or you can ask the vet tech to do it while your dog is sedated. Cracked or dry paw pads. Consider Paw Soother, an all-natural protector that rejuvenates dry, slippery pads. It's available in pet stores and on Amazon. Congratulations! You officially know how to prepare like a pro. I'm looking forward to seeing you in the next video.